So big thank you to What's the Matter Festival, Marina, Rory, Rebecca, for inviting us to come along and host this workshop about navigating conversations on air quality, health, and personal values that can get a little bit uncomfortable sometimes. I have a feeling that many of the people who are joining this workshop have experience with this. You're already talking and working on air quality, and it's likely that you've entered into situations or conversations that have felt uncomfortable, where you're not necessarily clear on what's appropriate to be communicating about, or unsure about how to share what you know, your perspectives, your understanding, information that you've come to. So we're going to talk about that today. And I'm joined by a number of facilitators with specialized backgrounds. We've got Dr. Nicole Cowell joining us from Imperial as well, and she specializes in air pollution science, measurement, and policy. We've got Dr. Carl Dudman online, who's an anthropologist. We've got Daniela Watson, who is a climate behavior and psychology specialist. And we've got Munira, who works in communities and is bringing social and cultural experience and insight from her work on the Well Home Project, which focused on indoor air quality in 100 homes across West London. So we've got a lot of different experience and insight and tools to draw on as we start to practice some of these conversations today. So the workshop's going to be about 2 hours, and I'm going to try not to talk at you too much, and have lots and lots of opportunities for self-reflection, group reflections, and then at the end we're going to debrief all together. So, sorry, I have to kind of awkwardly go back and forth. So I've already given you a sense of what we're here to talk about today. And I don't need to explain to you why these conversations can get a little touchy. You know, when we start talking about air quality, very quickly, it can brush up against personal values. It can brush up against health, equity, politics, rights. And we're talking about the spaces and environments where people live, and you know, people have all different sorts of feelings and experiences about the rights that one has in the spaces where they live and move. There's also a large trust element that comes into these conversations. It's kind of trust between the person you're having a conversation with, and then trust of the general institutions that that are at the backdrop of our lives, with, you know, that are set up to try and manage air pollution risk. And not everybody necessarily trusts those institutions. Even myself at times find myself questioning those institutions, which is normal. And I think it's important to normalize that. So just emphasizing that these conversations can be difficult, even for specialists like yourselves who have a lot of experience with air pollution. You have a lot of knowledge about air pollution. I wanted to emphasize one thing right off the bat about today. So we're focusing on navigating conversations, talking about tools and skills that can help when conversations start to get uncomfortable, or maybe you're entering into a conversation or a space with someone and you're unsure whether to take that conversation in a certain direction, raise certain information about the risks of air pollution. We're not focusing, or we're not trying to win conversations. Yeah. Oh, could you just go 2 slides forward, please? Sorry, we have an interesting setup. Here we go. So yeah, just want to clarify right off the bat what this workshop is and what it isn't. So we're really going to be focusing on one-to-one conversations, the type of conversations that you would have more so with a friend, neighbor, or colleague. Also perhaps conversations that would happen more in the healthcare space or setting. And we're going to really, really focus and practice our listening skills, and paying attention to the values, emotions, and experiences that underpin how we make sense of our world, and kind of lean into that and listen to that as we're engaging in conversations with our peers. We're not discussing campaigning here. That's a very different type of conversation and information exchange dynamic. We're not going to be debating policies and facts, and we're not trying to persuade people or fix them. And that's a big lesson, and a very uncomfortable lesson at times. Coming to realize that it's not my job to change someone's mind. Sure, if I was in a campaigning conversation or talking about policy, that sort of thing, we're in a different arena. But with these types of conversations where you're talking with neighbors, working in communities, you know, in the professional setting, it's not your job, nor are you able to change someone's mind. That's not your place. So the sooner you accept that, the easier it can be to open up conversational space and have conversations that are more respectful, more open, more fluid, and can actually get you to a place where you find your common ground with those individuals. So we're going to go through some tools that can help facilitate that sort of dynamic. Also just want to flag, if at any point anybody feels uncomfortable or needs a break, please do excuse yourself, or raise your hand and one of the facilitators can come and help out. But don't want anybody to feel like they're being forced to cross any boundaries. Oh, next slide, please. Yeah, so just to reiterate, a successful conversation is not one that changes someone's mind. It's a conversation that leaves both people willing to continue talking with one another. That's what we're aiming for here. Next slide, please. So now we're going to move to some quick fire presentations that will take us through 3 sets of building blocks for having healthy conversations. So we're going to start off with a little bit on curiosity and vulnerability. Then I'm going to hand over to Carl and Munira to talk about listening and trust. And then lastly, I'll hand over to Daniela to talk about context and some insights gleaned from behavioral science and psychology. So next slide. I'm almost done talking at you. I promise I'm going to hand over to someone else soon. And also my apologies, this is a pretty chunky slide. I was having trouble paring it down. There's so much good information that I wanted to share with you all. And we can share the slides after the event if you're interested in going over them. But the points that I wanted to raise here are that curiosity is a really powerful energy. It's a really expansive energy. And it's something that can really open ideas up, open conversations up, rather than kind of closing it down. And you can engage in curiosity in a lot of different ways. You know, you can engage in intellectual curiosity, but also curiosity about someone's background, where they come from, what their world and their life is like. And leaning into that energy is a lot more positive, can be a lot more positive and productive, as opposed to coming into conversations from a closed place and a more like assumptive place where, you know, you fall into assumptions that somebody thinks and moves through the world in similar ways that you do. So yeah, think about curiosity and how you might lean into that in conversations. Um, so the other thing I want to flag is vulnerability. And there's insight and lessons from Brene Brown, which some of you might be familiar with, this sociologist who became famous through some TED Talks, now writes a bunch of books about the power of vulnerability and its disarming capabilities. When you share a bit of yourself, that encourages others to open up and share as well, and it breeds trust. And I'm going to leave that there, and I'll let Munira talk a little bit more about trust and respect. Wait, sorry, sorry, I'm sorry. Um, almost. I also want to flag the importance of safety and boundaries in conversation. And there's a very helpful framework called nonviolent communication, which sounds quite intense if you're not familiar with it, but it actually is a framework that was developed back in the 70s by a psychologist. And originally the framework was intended to have conversations in a way that don't result in conflict, more designed for kind of marital conflict or familial conflict. But the principles can be applied here in conversations, in any conversation really, where the goal is not to end up in conflict or in a place where you're feeling kind of uncomfortable with the person you're having a conversation with. So in particular, the first two elements of nonviolent communication theory, or NVC, as it's called, reinforces the importance of observation without judgment. So again, curiosity, coming to a conversation, to a moment with another person, just from an observational standpoint, and really trying to kind of let go of preconceived notions. Helpful questions here are asking yourself, what am I assuming is true here, so that you can kind of clock it and then move past it, move through it to a place of curiosity and observation. The second thing, super, super important, and hopefully I'm not just sharing things with you that you already know, but you need to continue to check in with yourself and how you're feeling while you're in conversations. I know this can kind of go out the window when you're kind of in the flow of conversations, but it's a good practice to get familiar with, because then you know whether you have bodily cues and a sense as to whether you're kind of feeling uncomfortable or stressed or kind of under pressure. When you feel stressed or under pressure, that's when defense mechanisms start to come in. So, the safer you feel, the more open your conversation can be. And if you feel unsafe, you can establish a boundary. And boundaries are super, super important. I'm not going to delve too much into them, but I do recommend reading up on them. And one easy way to establish boundaries is to be stating your experience using I statements. So when you're having conversations with people, I recommend, and this comes through the NVC framework, to always use I statements. This can be a bit challenging for academics in particular, because we often speak from a perspective of, well, this is a collective knowledge base. And remember, the types of conversations we're talking about today are not, political and campaigning. If I was speaking or lecturing to a big group of academics or researchers or politicians, I would be framing and phrasing my language differently. But when I'm talking to my neighbor, when I'm talking to, in my work, a group of people who work in kind of a high emission construction space, I'm going to be using more disarming language as kind of my introduction. I'm not going to come in and speak from like a third person omniscient place. I'm going to speak as a human. So Next slide, please. And I'm going to turn it over to my colleague, Carl. And we're just going to put him up on the screen for you all. Sorry, hold on a second, Carl. And can you turn your volume on too? And I'll turn.
Can you hear me? Hopefully that's a yes. Am I good to go, Kayla? Yes, okay, that's a thumbs up. All right. Hi everyone. I'll try and keep this brief, and apologies if I've been noticing my internet is a bit shaky, so I'm hoping I'm not just going to disappear. My name is Carl. I'm a lecturer at UCL, currently in science and technology studies, but my background's really in anthropology. And my work is really about climate change. It's about environmental issues, and specifically how people do or do not talk about them, especially in sort of awkward contexts. So I spent a year during my PhD, for example, living in North Carolina with rural conservatives who are very conservative, but also are very vulnerable to sea level rise, and basically looking at how that conversation did or often didn't unfold around the subject of climate change. So as well as that, I've done some work in climate change communication. And so when thinking about today, I thought, what tool I might try and offer for the conversation we're having is really to talk about listening, which is obviously such an important part of any kind of communication. And over the years that I've been working in climate change and environmental communication, I've really noticed a huge growth in a kind of recognition of the importance of listening. Not just telling people these are the facts, this is the truth. You have to uh, get with it, but understanding that part of communication and convince or creating a positive political atmosphere is about making sure that people are kind of receptive to one another. But one thing that I did notice is kind of prevalent among a lot of communication work is a tendency to try to understand a so-called hard to reach population in a way that implicitly is about finding smarter or more effective ways of convincing them of something. So if I was to go to North Carolina and listen to the people who are talking to me, and then find special ways of phrasing or framing the same information in ways that they would respond well to, namely not talking about climate change or downplaying the role of scientists or something, they might end up listening to me, but the kind of dynamics are the same. I'm basically somebody who's arrived and telling them, these are my facts, and I want you to basically accept them. And so the image that comes to mind for me here is one of a wolf in sheep's clothing. It's the same old stuff, but we're just finding ways of getting people to listen to it in under the disguise of being a friend or an ally or whatever. So in a paper that I wrote with a colleague a few years back, we referred to this as an instrumental form of listening, and we put that opposite a different kind of listening, which is actually truly receptive, a receptive form of listening, which is when you listen to people without the agenda of ultimately imposing your own understanding of things onto them. And it really leaves the door open to actually being surprised as well, to realizing that you perhaps there are things that you don't understand about the situation, things that matter to them, or reasons why your analysis isn't quite fitting with theirs. And it's a way of evening out the balance of communication between you. So just one example of where this might come into play is the concept of, for example, trusted communicators, which is something you hear a lot in communication, which is always a person perhaps situated within a community who is trusted locally and who can be a bit of a spokesperson to say the science or the policy, and who people will listen to. Well, that's an important figure to have, but the other side of that is, what's the directionality here? Are we just hoping that they will be the mouthpiece for whatever it is you're feeding them? Actually, oftentimes there are also other types of communicators who are also trusted among institutions, among researchers, who often are able to speak better on behalf of their community as well. So that means acknowledging, that there are things that you also don't perhaps understand, and that there's a sort of two bidirectionality of communication that needs to take place. So I'll leave it there just so that we can move on, but just one possible tool to take with you to ask yourself in future conversations, okay, I'm listening right now, but is this a form of instrumental listening or a receptive listening? What kind of listening posture am I assuming?
Thank you so much. Thank you so much, Carl. And now we're going to turn it over to Munira.
Hi everyone, my name is Munira. I am the member of
Yeah, just because the microphone is.
Yeah, of course. Hi everyone. Yes, my name is Munira. I'm a member of the community. I can call myself a researcher, I think now, because I have been part of a project, the Wild Home Project, which is about indoor air quality. I was one of their ambassadors. A fantastic project that really has done way more than just researching about indoor quality, but also opening up to collaborations between members of the community and researchers. And I think in our area, it has as well really built lots of bridges between the two, and helped kind of like remove lots of stigmas as well that one had for the other. I think I've come fashionably late, the typical, and then I thought to myself, as then I had to run again to use the bathroom, I thought to myself, oh my gosh, I think subconsciously I am actually showing the typical member of the community who's overwhelmed with everyday life and who constantly, and I felt terrible because I thought, who constantly feel judged and who constantly feel that we're not doing enough, or constantly feel it's either this or constantly feel abused, and it is, as much as I'm aware of this, it is really a constant battle and work in progress. So this is why it is extremely important, to I was saying, to have a very holistic approach when you are discussing, especially air quality. I think pretty much any topic with one, to embrace one's yourself before even going to the person you're discussing with. Embrace our own vulnerabilities before even moving into sharing with others. I think one of the as well advice that I would personally suggest is to look into compassion versus pity. Members of the public are often feel like they're pitied by researchers. Not even just used. I think used was an old kind of term, because we have kind of empowered ourselves a little bit and thought, you know, they need us just as much as we need them. But we often feel, yeah, kind of like there's that kind of superiority, which until you get to know and experience lots of different conversations and different uncomfortable conversation, you will then realize, you know, that hopefully you will realize that there is actually, you know, lots of equality, you know, in research, and it is about equality. It is about trying to do that, you know, that kind of like something for the others, you know, not there isn't always, of course there is an agenda, but it's not just about the agenda. I think honesty is an extremely important element as well. I think it goes with the vulnerability, you know, when you are having a discussion. I think it's very important to, like, the I sharing, you know, own experiences, showing that at the end of the day, you know, I am a researcher, but I am as well a member of the community, and I am just like you. I have difficulties and weaknesses, and yes, my life might be acknowledging, you know, that yes, my life might be slightly different than yours, and I am glad. It doesn't make my life less valuable than yours. Yeah. Yeah, that's about it. I think my perception is, and I've worked in sales, funny enough, and I was a decent salesperson because I've always approached things very holistically. Like I said, you know, it's not about what I'm giving to you, it's about what we're sharing. And I think I'll leave it there.
Thank you so much, Munira. Such helpful advice. Now I'm going to pass it over to Daniela, if you wouldn't mind turning the sound on Nicole.
Hi everyone, can you hear me okay? Awesome. Sorry I can't be there with you today. I'm feeling unwell. So hopefully I'll get through this 5 minutes okay. I'm a health psychologist and behavioral scientist, and today I'm going to talk to you about one of the many models that psychologists use. So we actually have at least 82 theories and models to explain behavior and motivations and all things like that. But I'm going to talk through one today called the COM-B model, which was developed out of UCL. And it's in this context, I think it's really important to think about where someone is coming from and what's motivating those behaviors. So this model says that there's three factors, which are capability, motivation, opportunity, that lead to behavior. But also behavior can also change capability, motivation, and opportunity. It's kind of in both directions, bi-directional. And capability, motivation, and opportunity are split each into two. And I'm going to go through each and try and give an example related to air quality. So it says that the model says that each person has their physical capability and their psychological capability. Their physical capability are the things that they can physically do, what they're mobile, what their strengths are within their body. So for air quality, maybe it's physically, I don't know, closing a window or something that they can physically do. And if you can't do that, then that behavior is less likely to happen. The psychological capability are the mental, it's the mental kind of load. So it's about your knowledge, about remembering and having memory to do things. So if you don't know what behaviors you should be doing to protect yourself from air pollution, then it's less likely that you're going to do that behavior in the first place. But that's not to say that I think a lot of interventions in the past have always been about educating people. But this model shows it's a lot bigger than just like telling people what to do, as Kayla said earlier. The next one, I'm going to go to opportunity, and that is split between physical and social opportunity. And the physical opportunity is really thinking about what kind of environment a person has or it has around them in their homes, within their work or school or university or whatever it is that they're doing. You know, do they live next to a really, really busy road? And, you know, for a lot of people, they can't help their physical environment. I guess just acknowledging that, you know, when we try and support people to change their behaviors or to support people with, you know, what's going on around them, just really thinking about what they can and can't change. And often the physical environment is the thing that they can't change. And then there's a social opportunity, and that's the people around them that influence them. So that can be family, friends, colleagues, but also kind of like this event today, it can be, you know, scientists, health professionals, and anyone that they come in contact with. And they can both have positive and negative influence. But hopefully today we're having a positive influence on how you can better communicate with people about air quality. And then the final one is motivation, which is split into automatic and reflective. And the automatic motivations are those things that you do in autopilot. You do mostly without thinking, often very emotional driven as well. So these might just be things that you do in your daily lives. And you know, it might be things that is kind of almost inevitable, especially if you live in an environment next to a busy road. It might be inevitable that you know, the quickest way home is to walk past that really busy road. Whereas the reflective motivation, it's a lot more conscious. There's a lot more planning involved, and it also relates to your values and goals as well. So, for example, with this busy road that I keep coming back to, it could be that, okay, it takes 15 minutes longer to walk a little bit further out along the park, but at least at that point, you know, you're not being exposed to air pollution on that busy road, for example. So it's just having that planning process involved, but not everybody obviously has the environment to do that. So it really just depends on the person. So I guess this model is just to show that people have a lot of things going on. They have lots of different physical and psychological capabilities, different physical and social opportunities, and also different motivations going on. So just to really think about those when you're having conversations with people. Yeah, that is it from me. But yeah, thank you. I'll move back to Kayla.